Sacroiliac joint arthritis, or SI joint arthritis, is common among military veterans. In this video, I'll discuss what and where the SI joint is, what the symptoms of SI joint arthritis are, and what treatments are available. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation you deserve. Sacroiliitis is the general term. It's the bigger term than sacroiliac or SI joint osteoarthritis. It's an inflammation of that sacroiliac joint, the SI joint, and it causes a lot of pain. The sacroiliac joint is one of the largest joints in the body. It's a very, very common source of buttock and lower back pain. It's basically where the lumbar spine meets the pelvis in your lower back, just off to the side, again, connecting the bones of what's called the ilium, part of the pelvis, and the sacrum. Now, pain from this condition is often related to chronic degenerative causes. It can be caused by rheumatic conditions, infectious conditions, can be drug-related or tumor-related, but typically it's degeneration. There's a variety of different conditions that result in SI joint inflammation, the sacroiliitis, that lead to this pain. Osteoarthritis of that joint, degeneration of that SI joint, is the most common cause of that. Now, patients that have pain from the sacroiliac joint typically have pain in the buttock on that side up to about 94% of the time. Sometimes it can be midline pain. That's a little less common, about 3/4 of the time. And in about half of those cases, it leads to radiation down the leg, down to the lower extremity on that side. Treatment typically depends on really the nature of the problem, if it's degenerative or some other condition, but typically we start with physical therapy. That's typically very effective, especially if it's related to hypermobility of the SI joint. The physical therapy can stabilize the joint, can stabilize the muscles in that area to take pressure off that. If the pain's caused by more immobility, maybe the physical therapy can help mobilization, increase mobility of the SI joint. Anti-inflammatory medications can be helpful. Sometimes muscle relaxing medications can be helpful to decrease pain. Again, probably more effective in sort of the acute inflammatory causes of sacroiliitis more than the chronic SI joint arthritis. Injecting, whether it's an anesthetic or steroid or regenerative treatment, sometimes that can be helpful as well. If it's just a local anesthetic, can be very good for diagnostic purposes, meaning trying to figure out if the cause of the pain is the SI joint inflammation or degeneration versus some other lumbar spine condition. Whereas if it's cortisone, if it's a regenerative treatment, that would really be more for treatment purposes. If none of that typically works, sometimes radiofrequency ablation can be helpful for some patients, and surgery is typically thought of as a last resort, often some sort of SI joint fusion. Now, if you're learning more about the disability claims process, I wrote a free ebook. You can get it free. It's called The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. Just click the link in the description below. Make sure to subscribe to this channel. You can click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click that link in the description below. And as you read further down, you can learn more about working with me and working with my team. We do everything we can to make the process simple, make it quick, and I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.